Hello! In cases of trauma wounds, burns, scars after surgery, and additional wounds including diabetic foot ulcers, it is important to clean and dress the wounds according to doctor's instructions and to use BeCure Laser Pro as an adjunctive treatment. Samantha will now demonstrate for us how we treat wounds using the BeCure laser. In the event that the wound is covered by a dressing, perform the treatment at the time the dressing is changed. The course of treatment is to remove the dressing, disinfect the wound according to doctor's instructions, perform the treatment with the BeCure Laser Pro, and afterwards dress the wound again. We have sketched an image of the wound for illustration purposes. Start the device and set the treatment time to 8 minutes. For continuous device operation, press the elongated left side button while simultaneously pressing the round button. Release both buttons simultaneously. Now the device operates continuously. Place the device along the length of the injured tissue without direct contact for a period of 6 minutes. Hold the device approximately ½ centimeter over the wound. Do not treat on dressings or clothes. In the event that the area of the wound is wider than the surface of the laser, which is 1 centimeter by 4½ centimeters, set it again for 6 minutes and treat the adjacent area unit so that it will cover the entire area of the wound as well as its margins. Disinfect the device using 70% alcohol wipes after every treatment of an open wound. To make treatment more convenient, you can use the adjustable stand. Stabilize the device and the stand and treat without moving so that the laser beam penetrates deep into the tissues.
We didn't know about the result until we opened the codes. We were very surprised.
Diabetes is considered a real epidemic, and across the globe, people are searching for treatments and conducting research to try to find solutions to this problem. Here, at the conference of the Israeli Orthopedic Association, Dr. Hazeh from Hadassah Hospital will announce the results of a new study on one of the complications of this disease, the diabetic wound.
When we are looking on the closure of the wounds, the percent of closure of the wounds, you can see that in the low-level laser therapy, we have around 80 to 85% wound closure at the end point. You know that these are the numbers of around 15 to 20% of wound closure in normal patients. When you look at the starting point and the end point using the low-level laser therapy, this is the average wound size, and you can see the big difference between the starting point and the end point in the experimental group compared to the control, and it was very significant statistically. You can see that in the experimental group, 7 patients reached the end point, and on the control only 1, meaning that in 7 patients we had more than 90% wound closure. BQ laser POR, or the low-level laser therapy that we use, is safe, and it seems to improve and facilitate diabetic wound healing. That's why we are going to study it more and start treating our patients in the world with the BQ laser. Thank you.
A study was conducted among patients at Hadassah's podiatric clinic. In the study with a trial group, B-Cure laser was used with advanced bandaging. B-Cure laser was used once a day for 12 weeks. 85% of the wounds were closed in the trial group, compared to only 16% in the control group. These are remarkable results. Healing diabetic wounds with B-Cure does not come alone, but along with the standard usual bandages, it does an excellent job. The treatment is natural and non-invasive without any side effects. Total safety to the patient. It is easy to use for both patient and therapist. It is also suitable for treatment in a hospital and in any clinic in order to significantly shorten the patient's hospitalization days. It can be also used at the patient's home for further treatment for the ailment. The 2 major conclusions that can be drawn from the study are: B-Cure laser treatment is majorly safe to use. B-Cure laser treatment definitely facilitates diabetic wounds healing.
My name is Dr. Amir Levy. I am an anesthesiologist, which means I also deal with pain. And I treat many diabetic patients with complications such as chronic wounds. I had a wound that actually was an acute wound that became infected and required amputation. And the wound was infected and required continuous antibiotic treatment intravenously. And when we saw the wound, we realized that the treatment was going to be extensive. The treatment was indeed multidisciplinary in the hospital as well as outside the hospital, but all the while, since we truly are a big hospital and we encounter many technologies, so this was one of the technologies we encountered. And since there was already full treatment of the wound, we thought maybe it was worth it to try and, well, what we did in the research group, I was selected because I complied with the criteria. The treatments took place at home. I was no longer hospitalized, so it was very convenient. And as I mentioned, the treatment is very, very simple. All you do is aim the device at the wound at a distance of a few centimeters. You know it is positioned correctly because there is a light beam that indicates where you are aiming. Sometimes you'll feel paresthesia, but it doesn't hurt, it doesn't irritate, and it doesn't bother you. And what I saw when I was treating my wound was that it was closing. It was deep, it was relatively wide, and, well, it did not look good. So there was no option in this case, there was no surgical option of closing it with different surgical means. And even if there was, the chance of it working had a low estimation of success. Therefore, there was talk of conservative treatment, and then the B-Cure Laser Plus came along. And what I saw, that within something like 6 or 8 weeks, the wound was closing. I mean, the surface area decreased, as well as the depth, until it actually closed completely. And what was left, like after every wound, was a small, non-irritating scar. It saved me from surgeries that surely would not have succeeded. In fact, it saved me from, I guess, from a much longer process from the treatment. The conventional conservative treatments. So there was an added value. Since then, the wound is closed and hasn't reopened, and it all looks great. In fact, it disappeared, and that's it. The problem was completely solved. As you know, diabetes is a worldwide epidemic, which means that the number of people who suffer from this disease is growing. And obviously, so do the complications. I work at the Hadassah Hospital in Jerusalem, which is a big hospital and is a very academic hospital. And in that time, we even conducted extensive research on people and tested a device that is called BCure laser. We tried using the device really on, in a controlled manner on chronic wounds. The BCure Laser Pro, its biggest advantage, in my opinion, is that it is not invasive, which means the treatment doesn't hurt, it doesn't irritate, it doesn't bother you. It is very simple, anyone can use it, and all that is needed is for the device to be aimed at the wound for a few minutes a day. And we know from the research we conducted that when we compare it to other wounds, the healing time is shorter and the healing looks, well, the healing is better and more complete. My personal experience is fantastic. It works, no doubt.